Okay, hello everyone. So we are going to start the session here. Let me check, am I audible so that we can start the session now. This is the Clinical Anatomy Quiz Part-2, targeting the examination. So we are targeting the examination for the NEET PG 2022 examination. So am I audible? Those who have joined, please let me know, am I audible? Okay, so we can start the session now. Okay, before starting the session, meanwhile, the students will also join, the aspirants will join. I would like to tell you about myself and about the platform of Unacademy. Myself, Dr.Monalisa, MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss the clinical anatomy MCQs related to the topic and targeting your competitive exam NEET PG 2022. Before starting the session, few points about the special class features. What are the positive point of special free platform on the Unacademy? So you are going to participate in live interactive session, which is highly beneficial for you. Okay, this session is highly beneficial for you, and also polls are conducted among the learners, so you can know your weak areas, you can know which is the part which needs to be revised and which has to be paid more attention. Raise your hands and get your doubts clear right itself when the session is going on. Never ever miss a session. Lecture notes and PDF notes will be provided to you once the session is finished. Anytime, anywhere, read from the top educators of Unacademy platform. So these are the benefits which can be catered by you. Anatomy MCQ session. Good afternoon dear Militia, good afternoon. So my dear aspirants, few of the aspirants and few of the students has told me, ma'am, please discuss also the whole series and what are you planning. So these are the series of anatomy MCQ session. This is all target for the NEET PG 2022 examination. These are the sessions which I am taking on the special free platform of Unacademy. So my dear aspirants, how you can see the sessions on the free platform of Unacademy? These are the sessions on the Unacademy free platform. For this, you have to download the Unacademy app. You have to use my code ANAT10 for unlocking the session. So my code is ANAT10. For this, you can unlock by using the code ANAT10. You can find your goal as NEET PG, and via the link of my session, which is always provided on the Unacademy Telegram group, you can reach through the session live. So on 3rd January, upper limb 2 sessions 6 p.m. and 7 p.m. The sessions will be of just 40 minutes each. 4th January, Tuesday ko upper limb 4th and the 5th session. That means 4th January, whole of the upper limb MCQs will be finished. 5th January, we will target thorax 1 and thorax part 2. 6th January, thorax part 3, and I will start with the histology MCQ session. Or 7th January, Friday, I will finish with the histology MCQs. So this is the plan till 7th January, Friday. All of you do present live for this session. This will be highly beneficial. Use the unlock code ANAT10 and do present live for the session. The new aspirants, so download the app and be present live. My dear aspirants, let's talk about the plus subscription. When I am talking about the plus subscription, I mean to tell that all 19 subjects for your competitive exam will be targeted in a very systematic way so that you can get a better rank in the competitive exam. You can study from the top educators of Unacademy platform. You can compete in live tests and quizzes. You can study on the device of your choice. You can assess more than 25,000 MCQs, which will be highly beneficial for you. So you can assess both all the clinical MCQs of all 19 subjects, which is helpful for targeting a better rank in the competitive exam. Other than that, with the printed notes, you will also be provided with the printed notes of Unacademy, which will be taken by you if you are going to take the subscription of 1 year or more, and you will also get the brief and important explanation for each and every of 25,000 MCQs made by the top educators of Unacademy platform. Now let's talk about the Iconic subscription. In Iconic subscription, not only the benefits of the plus live sessions, but also the benefits of prep ladder is added on. What does that mean? That you get access to 2 best platform for your examination. So here you can have the sessions of clinical integrated sessions, video lectures of the dream team. QBank 3 can be assessed with active guidance, tag, rapid revision, snapshots, dream notes, treasured dream notes of 2021. So my dear aspirants, you can target all these and this will be highly beneficial for you. So before starting the session, I would like to show you this comparison detail of NEET PG and Iconic subscription, where you can use my code ANAT10 and have a discount of 22%. This is an offer which is given by the Unacademy platform. You can resolve this. You can have your goals completed by using this code 22. So what is this? 22% discount by using the code ANAT10. So what is the code? ANAT10 is the code which will offer you 22% discount, but the date is till 3rd January, 1st, 2nd and 3rd. So, 1st is already gone. So, 2nd and 3rd January, if you are going to take the subscription, you get a benefit of 20% discount, 22% discount. I am so sorry, it's 22% discount. It's not 20%, it's 22% discount. So, just go and grab the opportunity of Iconic and NEET PG subscription. My dear aspirants, let's start with the MCQ session. So let's start with the first MCQ of today's session. First MCQ, all the best, all the best. So I will wait for you for 30 seconds only, my dear aspirants. I will just wait for 30 seconds, 15 to 30 seconds. Otherwise, I will come up with the my own explanation. Okay? Yeah. A 22-year-old man has suffered from headache, some muscle weakness to his upper muscles of the back for the last 6 months. Okay, so this complaint of the patient is for the last 6 months. An MRI scan has been done which is showing you a large tumor which is compressing. This MRI scan is showing the tumor which is compressing the suboccipital and the greater occipital, suboccipital and the greater occipital nerve. So these are the key points which is provided in the MCQ. Which of the following muscle will most likely still be functional in this case or functioning normally? So the options are rectus capitis posterior major, rectus capitis posterior minor, semispinalis capitis, splenius capitis, obliquus capitis superior, obliquus capitis inferior or lateral. So your time starts now and you mark the correct answer. Which is the best answer, dear? A, B, C, D, E. 5 options are there and you have to cater the best answer. Your time begins now. All the best. Just 15 to 30 seconds, my dear aspirants. Just 15 to 30 seconds. I got an answer from Sam. What about others? So Sam has already given his answer. What about the others? Tripti, okay, okay. So yes. Okay. So my dear aspirants, I would like to tell that the answer given by Sam is absolutely right and splenius capitis is absolutely correct answer. So splenius capitis is the correct answer. Why? I will tell you, because here the MRI scan is showing. So let me highlight the key features. Tumor is compressing the nerves. So tumor is compressing which nerve? It is compressing suboccipital and greater occipital nerve. It is compressing suboccipital and that of greater occipital nerve. See here, these are the nerves which is getting compressed, suboccipital and the greater occipital nerve. Okay, so these are the nerves which is compressed here. These are the key points which has to be mentioned, and so we have to know which muscle is normally functioning. That means the muscle which is not getting innervation from these nerves are the correct answer. So this is the reason splenius capitis is the correct answer. The splenius capitis is getting innervation from. Please note down, my dear, this has been asked in MCQ and this is important for you to know that splenius capitis is a muscle which is getting innervation from dorsal rami. It is getting innervation from dorsal rami. It is getting innervation from dorsal means the posterior ramus of which nerve? 3rd and 4th cervical nerve. It is getting innervation from 3rd and 4th cervical nerve. So this is the correct answer. Now my dear aspirants, let's move on to the other option. So obliquus capitis, if we talk about obliquus capitis muscle is innervated by the branches of suboccipital nerve. C1 is the root value which supplies also rectus capitis posterior major and minor. Actually the muscles which is lying in the vicinity of the suboccipital region, these are getting innervation from suboccipital nerve. When I talk about greater occipital nerve, the other option which was provided was greater occipital nerve. Greater occipital nerve is supplying semispinalis capitis. So all these points which I am highlighting here, is important for your MCQ. Rectus capitis posterior major, obliquus capitis group of muscle, rectus capitis posterior major and minor getting innervation from suboccipital nerve. Semispinalis capitis is getting innervation from greater occipital nerve and splenius capitis is getting innervation from 3rd and 4th cervical nerve dorsal rami. Great. So I got an answer right from Sam. Let's move on to the second MCQ. So before moving on to the second MCQ, I want to show you this diagram. So should I elaborate it? So let me slightly enlarge this diagram. So is it okay? Is it visible to everyone? Yeah. So see here, if I talk about this triangular space which I want you to focus and I want you to see is this triangular space which you are seeing on the posterior aspect. This is the suboccipital region, suboccipital triangle. So yes, let me outline the boundary of the suboccipital triangle. So this triangular space which you are seeing is the suboccipital triangle. This is the suboccipital triangle. Now, the suboccipital triangle is bounded by, can you see obliquus capitis superior muscle? So, if we see the obliquus capitis superior muscle, this is the obliquus capitis superior muscle which is forming superolateral boundary. This muscle is forming superolateral boundary. If we see the rectus capitis posterior muscle, so actually it is also having close, just adjacent to it will be rectus capitis posterior major, but if we talk about rectus capitis posterior major, it is forming supromedial boundary. So it is forming SM means supromedial boundary, obliquus capitis superior is forming suprolateral boundary. Now, which muscle is residing inferiorly? Let's see the other one. The muscle which is forming inferior border, as you can see in the diagram, is obliquus capitis inferior muscle. So the name inferior and the inferior border is formed by obliquus capitis inferior muscle, and the nerve which is sprouting out from this triangular space, the nerve which is sprouting out from this triangular space is posterior ramus of C1, and posterior ramus of C1 means suboccipital nerve. Which nerve is this? This is so this is suboccipital nerve. This means this is suboccipital nerve, and suboccipital nerve is supplying the corresponding rectus, obliquus and all these corresponding muscle which is forming the boundary, and lying in the vicinity also rectus capitis inferior muscle, rectus capitis posterior minor muscle is getting innervation from suboccipital nerve. So is it clear? Let's move on to the next question number 2. All the best. A 22-year-old pregnant woman underwent epidural anesthesia in the anticipation of labor. Okay, so while having a delivery, epidural anesthesia has been given, vaginal delivery, to have a painless delivery. After delivery, she developed back pain, right lower extremity weakness, and imaging revealed a hematoma in the epidural space resulting in compression of nerve that exit at the level of L2, L3. So, which of the following vessel is most likely to be responsible for the formation of hematoma? Okay, options are internal vertebral plexus, great radicular artery of Adam-Cavich, anterior spinal artery, posterior spinal artery, or external vertebral plexus. So, your time starts now. You will get 15 to 30 seconds. You can take 30 seconds to mark the correct answer. Your time begins now. Question number 2. All the best everyone, all the best. So the key point is the space, epidural anesthesia. That means which space has been approached. See here, epidural anesthesia is given for painless vaginal delivery in this case. So this is the space which has been approached. So what is the reason of pain or hematoma? I got an answer from Sam, it's external vertebral plexus. What about others? What about others? Dr. Salona is telling me. Okay, mixed bundle of answers are coming up. Mixed bundle of answers are coming up. Let me see. So you can see the imaging is relieving. When the imaging has been done, the hematoma is in the epidural space. I am giving you the hint dear. मैं hint दे रही हूँ. Now give me the correct answer. I am giving you the hint. So no one is understanding the hint, I think, but hint नहीं समझ पा रहा है. Epidural space is approached. So my dear aspirant, the correct answer is internal vertebral venous plexus. In epidural space, the nerve the plexus of which is located is internal vertebral plexus, not the external vertebral plexus. So this is the reason. So let me explain you. Epidural anesthetic procedure which is done is in the epidural space, and we know that epidural space is containing internal vertebral plexus, Batson plexus, and also fat. Okay, so that means internal vertebral venous plexus is the reason of involvement and compression, which is the reason of hematoma formation. So because of internal vertebral plexus, there can be hematoma, and this will lead to compression of the nerve. So when there is accumulation of fluid, blood is accumulated, or any kind of bleeding has been occurred, this will lead to the compression of spinal nerves and possibly result in severe pain and deficit, which was mentioned in this MCQ. So this is the reason for the correct answer. Now, I would also like to show you a schematic diagram to help you to understand the location of internal vertebral venous plexus. Internal vertebral venous plexus is located in the epidural space. Now, my dear aspirants, epidural space means the space which is lying outside the dura mater. So, let me first tell you where is the dura mater. This is the green color I am using for highlighting the dura mater. See here, and just external to dura mater, the space which you are seeing here, which I am highlighting with light blue, this space is showing internal vertebral venous plexus, and this is the space which is containing internal vertebral venous plexus. The space is epidural space. Okay, inside the other spaces which has been visualized is the subdural space lying inside. Okay. So, subdural space has been shown, also the subarachnoid space. So, I would like to use another color, subarachnoid space, which is full of CSF fluid. So, CSF fluid is there. So, this is the subarachnoid space which is filled with CSF, which is approached for giving anesthesia, spinal anesthesia. See here. So, all the spaces has been highlighted here. So, now it is quite clear that it is the location of internal vertebral plexus which is responsible for hematoma and which is responsible for the nerve compression. So, is it clear to everyone? Please let me know. If it is clear, please give me a thumbs up. Is it okay? Internal vertebral venous plexus is the right answer. Okay, now see here, when we talk about other options, so let's talk about incorrect options also. So, incorrect option, what about the incorrect option? The other option which was provided, for example, medullary artery of Adam-Kevich. We know that medullary artery of Adam-Kevich is a artery which is giving large chunk of blood supply to the spinal cord, and actually this is the largest chunk of blood supply is provided with it, and actually the location is T10 at time T11. So, you can see it is much higher to the level of L2 and L3 which was given in the MCQ. So, it is a wrong option. So, artery of Adam-Kevich is not the right answer because the level which was mentioned in the MCQ was L2 and L3, and it is quite low as compared to T10 or T11. Anterior posterior spinal arteries, as we know, is located in anterior, median and posterolateral fissures respectively, and these arteries are not located in the epidural space. So, this is not the reason of pain or hematoma formation. So, these are incorrect. Now, one of the option which was confusing us was external vertebral plexus. If we talk about external vertebral plexus, it is lying outside the vertebral canal. So, it can't produce hematoma in this case. So, it is also wrong option. It is lying outside to vertebral canal, outside space. So, this is the reason we have got the correct answer here as A, internal vertebral plexus. So, let's move on to the next, that is question number 3. All the best to everyone, all the best. Yeah. So, a 7-year-old boy is undergoing surgery to remove a tumor from his spinal cord. During the surgery of the spinal cord, which of the following structure can be used as a landmark to identify anterior rootlets from posterior rootlets? So, you have to identify the nerve rootlets. So, you will take which of the following structure as a landmark, whether you will take it the ligamentum denticulatum as an landmark, filum terminale, conus medullaris, posterior longitudinal ligament or ligamentum flavum. So, your time starts now, 15 to 30 seconds, mark the correct answer. Okay, Mulai Vedan D. Okay, I got an answer from Mulai. What about other? Okay, I got an answer A also. I got Shiny Devnath is telling A, Tripti is telling B, Mulai is telling D. Mixed bundle of answers is coming up. So, a landmark to identify anterior rootlets from posterior rootlets. So, Sam has given A, third ka A, very nice. So yes, Sam and Saini, you are perfectly right. It's the ligamentum denticulatum. If you remember, ligamentum denticulatum or denticulate ligament is modification of which structure? It's a modification of pia mater, and it is exactly located between the anterior and posterior nerve rootlet. So exact location of ligamentum denticulatum or denticulate ligament is between the anterior and posterior nerve rootlet. So this is important for the landmark. This is an important structure which can be used as a landmark to locate the nerve rootlets. Okay, so let's talk about the right answer and let's also talk about the wrong option. Okay, so 5 options are there. Let me explain you. When we are talking about ligamentum denticulatum, it's a sheet of pia mater which is running longitudinally like a 2 ribbon. So it is in the form of longitudinal ribbon or band which is lying on either side of the spinal cord. Actually, the exact location of ligamentum denticulatum is between anterior and posterior nerve rootlet, and it is acting as a serving point for differentiating and locating the anterior posterior nerve rootlets. So this is the reason, and this was asked in the MCQ. This is the right answer. Now, if I talk about another options, conus medullaris. What do you mean by the word conus medullaris? Ending of spinal cord. The ending of spinal cord or the terminal end of spinal cord which is at the level of L1 lower border is not the correct answer. It is not used as a landmark for nerve rootlets. Phylum terminale is also a modification of pia mater, but it is lying lower to the level and it is extending till the level lower down. It is approximately 20 centimeters and it is extending in the dural sac, and so it is not the right answer. Posterior longitudinal ligament is lying in relation to the vertebral body's posterior aspect. So this can also not give us the right location of nerve rootlets of the spinal nerve. So this is also wrong option. Let me show you few diagram. So see here, this is conus medullaris, the lower or you can say termination of spinal cord, and this termination of spinal cord is occurring at the level of lower border of L1. Lower border of L1, that is the first lumbar vertebra. At that level, the ending point of spinal cord takes place. Lower to this level, you can see phylum terminal. This is phylum terminal internum, approximately 15 centimeters. This is phylum terminal externum, approximately 5 centimeters, till the level of second sacral vertebra. S2 or till the level of second sacral vertebra. Okay. Now I would like to show you a cadaveric image for it. Let me just highlight this diagram to show you this cadaveric image. So when I am showing you the cadaveric image, here also you can clearly see conus medullaris part where the spinal cord is ending, and so many nerve rootlets are emerging out together. They are called as coda equina. Why? Because the appearance of these nerve rootlets is like the tail of a horse, and it is consist of lower 4 lumbar nerves and all the sacral nerve and the coccygeal nerve. Together the lower 4 lumbar means lower 4 lumbar nerves, lumbar spinal nerves along with all sacral nerves along with the coccygeal nerve. Together they will form a appearance of a bunch of nerves which will appear like the tail of a horse, called as coda equina. Okay. So this is which has been shown, and phylum terminal is extending till the level of sacral vertebrae, S2 sacral vertebrae. Now let me show you few other diagrams also for ligaments. Actually, when you will see, let me again highlight this diagram. So if you will see the longitudinal ligament which was mentioned in the MCQ, so you can see here this ligament which is lying on the dorsal or posterior part of the vertebral bodies, as you can see here, this which I am highlighting with green color. So see here, which I am highlighting with the green color, this part is called as posterior longitudinal ligament. This part is called as posterior longitudinal ligament which is lying on the posterior aspect of vertebral bodies. Adjacent part of the laminas will also have ligamentum flavum. So here we have got ligamentum flavum, and in between the spines we have got supraspinous, interspinous ligament. So these are in relation to the vertebral body. They have nothing to do with the spinal nerve. So this is not the right answer. So here we have got the right answer. Ligamentum denticulatum. Actually, ligamentum denticulatum has got a shape like this, triangular projections, okay, and the lowermost is having the shape like fork. So, and this will be running in between the nerve rootlets, okay, this will be running in between the nerve rootlets, that is anterior and posterior nerve rootlets. So 21 21 number. How many numbers are there? 21 numbers of ligamentum denticulatum is there, and last pair of ligamentum denticulatum, ligament denticulate. Can anybody tell me last pair T12 or L1 spinal nerves पे end करता है, T12 or L1? So let's move on to the next, that is question number fourth. Okay, sorry. Okay. A 48-year-old man underwent suboccipital surgery whereby the surgeon made a midline incision through ligamentum nuchae that began 1 centimeter inferior to external occipital protuberance and ended at the level of C2 cervical vertebra. Where it is ending? It is ending at the level of second sacral vertebrae. It is ending at the level of second sacral vertebrae. Okay. The surgeon then placed a self-retaining retractors into the incision to forcefully separate the tissue so that an adequate surgical field is existed for the duration of the surgery being performed, which would be lasting for 3 hours. So see here, a long duration surgery is going to be performed which is lasting for 3 hours. During the recovery process, the patient complained of severe occipital pain and was diagnosed with post-surgical occipital neuralgia. Which of the following nerve was most likely directly stretched by the retractors being used during the surgery and was resulted in the patient post-surgical pain? The patient is complaining of post-surgical pain afterwards. Options are third occipital, suboccipital, greater occipital, lesser occipital or spinal accessory. So my dear aspirants, 5 options are there and mark the correct answer. The hint which is provided here is midline incision. The patient is having a midline incision towards ligamentum nuchae 1 centimeter inferior to external occipital protuberance. Midline incision at the level extending to the level of C2. Duration is also important. 3 hours duration है तो post surgical इतना for so much long period of time there is a retractors being used, so there can be a pain or complaining by the patient is occipital neuralgia. Now tell me which is the nerve responsible for the case. I got an answer from Sam, I got an answer from Vedan, so I got an answer C, I got an answer B. So anyone else wants to give more of the answer? Let me see, anyone else wants to give the answer? Okay. So Tripti is also telling C as the correct answer. Okay. Okay, so let me just mark the correct answer for question number 4th. Okay. So here the correct answer is, my dear aspirants, the correct answer here is, if we talk about the correct answer for question number 4, the correct answer is third occipital. Third occipital is the correct answer. So for this you have to know exactly the area which is involved. You have to directly know which is the area which is involved here, and if we go for making an incision through ligamentum nuchae, so what is the location? Here we can see the incision is midline incision through ligamentum nuchae 1 centimeter inferior to external occipital protuberance. Okay, so external occipital protuberance के पास है, तो यहाँ पे उसका nerve supply का area is done by third occipital. Let me explain you. So see here, the correct answer is third occipital. The reason is that third occipital nerve is the nerve which is giving innervation, which is actually formed by the dorsal ramus of third cervical nerve. So the origin is from dorsal ramus of third. The origin is from dorsal ramus of third occipital nerve, and this is giving innervation to the area which was exactly mentioned in the MCQ. It pierces the trapezius muscle. The dorsal ramus of the third occipital nerve will pierce the trapezius muscle medially in the neck and will extend from the area of innervation of this nerve will extend from external occipital protuberance and will give innervation to the skin on the nuchal area. Yes, post-surgical, which of the following nerve was most likely stretched? No, sensation, dear. So, motor innervation, actually, which all nerve is given? Spine, I will give you the correct and incorrect. So, exactly the nerve which is lying over. So, when we retract the occipital region at this area, Sam, we are retracting third occipital nerve for such a long duration of time. So, pain sensation can be there. Okay, pain sensation can be there, yeah. So, which of the following nerve was directly stretched? What is asking? The question is asking which nerve is stretched. See here, which of the nerve is stretched by the retractor? Which of the nerve is stretched by the retractor, and that is the reason for the pain, post-surgical pain. See here. So, exactly if you will see external occipital protuberance or midline may, the nerve which is located is the third occipital nerve. So, this can be the reason. So, when we are retracting it, we are injuring which nerve? Third occipital nerve. So, actually the location is important, Sam. The location is important. So, here if you will see the other nerves like suboccipital nerve, yes, you can say it is supplying many muscles. Spinal accessory nerve is also supplying mainly the trapezius and that of the sternocleidomastoid muscle, but location was very important in this case and long duration tak retract kiya gaya hai for 3 hours of surgery. So, this is the reason, third occipital. This is the reason for the post-surgical pain, and which nerve is stretched has been asked in the MCQ. So, we will go with third occipital as the correct answer. Now, see here, the greater occipital nerve and the lesser occipital. So, my dear aspirants, see here, यहाँ पे greater or lesser occipital nerve is also there. In this diagram, you can see these are the greater and the lesser occipital nerve. So, greater and lesser occipital nerve is also lying in the vicinity, but it is lying slightly laterally. If you will see these nerves are located slightly lateral. These nerves are slightly lateral. So, this can't be the reason of pain in the patient. Midline location में third occipital nerve है. This image and this diagram is clearing you the doubt of location. See here. So, the greater and lesser occipital nerve is lying slightly laterally, so it is not correct. When we are talking about suboccipital nerve, it lies within the muscles of suboccipital triangle. It is exactly located within the muscles of suboccipital triangle. When we are talking about spinal accessory nerve, it supplies trapezius and sternocleidomastoid muscle, and it is not giving any cutaneous supply to the neck. So, agar muscular spasm has been asked, then only we can go for spinal accessory nerves or that of the suboccipital nerve, but cutaneous sensation will be involved. When retractors are used, the nerves can get compressed in the midline. Got it, Sam? So, let's move on to question number 5th. An unconscious 2-month-old infant is admitted to the emergency department after an automobile collision. Unconscious 2-month-old infant is admitted to the emergency department after an automobile collision. An emergency tracheostomy is performed. So, which of the following structure is most likely at highest risk of injury during this procedure? Left brachiocephalic vein, left common carotid artery, vagus nerve, phrenic nerve, thoracic duct. Question number 5th. 2-month-old infant, emergency tracheostomy has to be performed. So, highest risk among the following options: thoracic duct, phrenic nerve, vagus nerve, left brachiocephalic, which is exactly to be having a highest risk. Mafis has joined. Which of the following structure is at a highest risk of getting injured? Okay, mixed bundle of answers are coming up. So let me give the correct answer. Saini is telling A. Tripti is telling B, Mafis is telling A, Sam is telling C. And my dear aspirant, the correct answer is left brachiocephalic vein. A is perfectly correct answer. Actually, this is the left brachiocephalic vein is exactly located anterior to trachea and it is lying in more midline. So there is more chance of left brachiocephalic vein getting injured. Okay, so we will go with A as the correct answer. So in case of tracheostomy, when a tracheostomy is being performed and an incision is made at the level of generally, yes, you are right, Mafis, but it can, in case of infants, it can injure more of the structures and it can proceed till to the superior mediastinum also it can happen, but the most important structure being injured and very close midline. So we know that brachiocephalic vein is extending more superiorly also, and there is chance of the left brachiocephalic vein which is lying immediately anterior to brachiocephalic trunk. So vein is more superficial. So we will go with left brachiocephalic vein as the correct answer. Yes, absolutely right, Mafis. Absolutely right, dear. Absolutely right. Okay. So yes, left brachiocephalic vein passes across the trachea immediately anterior to brachiocephalic trunk. So this vein is actually more superficial. The location of the vein is more superficial structure and thus is most likely to get damaged. So it is getting more, there is more chance of brachiocephalic vein being damaged in this case. So we will go with brachiocephalic vein left hand side as the correct answer. Is it okay, everyone? Now I would like to show you this diagram. See here, in this diagram you can see the superior vena cava. This is the superior vena cava, as you can see, slightly laterally, and it is dividing into left brachiocephalic vein and right brachiocephalic vein. So which is lying more close? Can you appreciate in the diagram which is lying more close to trachea or anterior to trachea? Which is lying more close or anterior to trachea? Left brachiocephalic vein is lying more close to this tracheal ring. So here this is the trachea and it is lying more close. So when we want to go for emergency tracheostomy in case of infant, the most important structure getting affected is left brachiocephalic vein because of the location. Slight lateral to it, the important arteries, branches of arch of aorta, superior vena cava and brachiocephalic trunk is lying, as you can see. But you can see brachiocephalic trunk is lying posterior to brachiocephalic vein. So more chance of brachiocephalic vein is to be injured. Is the doubt clear to everyone, those who have done the mistake? Okay, Sam? Okay, now let's move on to the other option. When we are talking about left common carotid artery, the other option which is mentioned is left common carotid artery, vagus nerve, phrenic nerve. So actually when we are talking about left common carotid artery, vagus nerve and phrenic nerve, this all option which is given in the MCQ is not correct. Why? Because they are not exactly lying in the midline incision, and we know that tracheostomy के लिए midline incision prefer करते हैं. Thoracic duct is more posterior, my dear. So it can be penetrated अगर बहुत deep injury हुई तो thoracic duct is located more posterior and lateral to esophagus and trachea, and more commonly it is not injured अगर intentionally, if anyone wants to make a hole or can cause a, if somebody or the surgeon goes more posteriorly, then there can be injury to thoracic duct, but generally brachiocephalic vein is most commonly injured. Is it okay, everyone? Have you understood? Actually, I wanted to extend the session for another session. So, tomorrow also I will update you about the session, and we will have the session on the 3rd Jan also, don't worry. So, let me just, I will let you know. So, before ending the session, I would also like to tell you about, before ending the session, I would like to give you the timetable of my session and the so see here, let me just, those many students must have joined late, so I will let them know that they are not going to miss any of the session, and we will continue our clinical anatomy series on the YouTube. Is it okay? हम अपना clinical anatomy MCQ का series continue करेंगे Let's Crack NEET PG platform में for targeting NEET PG 2022 examination. So here 3rd January upper limb 2 sessions of MCQs targeting for the NEET PG 2022, but this doesn't mean that it is not important for INICT. The students targeting INICT and FMG all can join, because now the MCQs are overlapping and the target is next, so all can join the session. On the free platform of Unacademy, download the Unacademy app, present live for 6 PM and 7 PM session, small session of just 40 minutes each. 4th January upper limb 4th and 5th session. 5th January Wednesday thorax 1 and 2 session. 6th January Thursday thorax 3rd and histology. 7th Friday histology 2nd and 3rd. So this is how we are going to proceed. Timing will be similar for you, 6 p.m. and 7 p.m. So please note down, the link of all the session will be provided in Let's Crack NEET PG and INICT Unacademy group. Unlock code is ANAT10. So how you can come live for the session? If you are using the platform of Unacademy for the first time, use the code ANAT10 for unlocking the session. Okay. Also, before ending the session, I would like to tell you that this is the pricing detail which has been shown to you about NEET PG and plus subscription, and an offer is going on. The offer is of 22% discount. This is valid till 3rd. This is valid till 3rd January. So just go for it. Grab this opportunity and take 22% discount if you are going to take the subscription till tomorrow. So use my referral code ANAT10 and avail the opportunity of 22% discount. Okay. And this is what I want you to tell. And before ending the session, I want you to know, I want to thank all of you. So do join live for the session. All the best. Keep studying. Tomorrow there is 6 p.m. and 7 p.m. upper limb MCQs continuing, and on YouTube our discussion of all the clinical anatomy MCQ series will continue. All the best. Keep studying. Thank you so much. Thanks aspirants for being live. Thank you so much. All the best. Keep studying. Thank you dear aspirants. Thank you my dear aspirants.